Hello, I am Dr. Sachs. I will be your attending physician for the day. Now, first of all, let's take a look at your chart and see exactly what we're dealing with today. Oh, I see. Oh my. Okay. Well, according to your chart, you're dealing with the most terrible malady in the history of medicine, and the malady of erectile dysfunction. Robbed of your manhood in the prime of your life, rendered as limp as freshly cooked spaghetti. Truly a deplorable situation. Not that I would know, but truly deplorable for patients such as yourself. But not to worry. Together, we're going to work through this and get you back functioning like a young man should be able to. But first, let me ask you a few questions so we can possibly determine the cause of your limpness. Just sometimes. So exactly how long has this issue been going on? Okay. About 2 months, you say. Have you experienced any recent life changes in this time? Any additional stress, for example? Okay, so everything has been basically the same. I see. Okay. Very odd indeed. Typically, erectile dysfunction, or ED, or limp weenie, as it is sometimes known, affects older men. Now, according to your chart, you are only 26. So, honestly, you should still be getting erections like just something akin to the hardness of quartz. You should be injuring people with your erections at the age of 26. Well, first, let's rule out some of the most common causes of erectile dysfunction. Now, are you on any antidepressants, for example? Okay, no antidepressants. What about depression? Have you suffered with depression or severe anxiety, for example? Cool as a cucumber, you say? Strange indeed. Let me ask you this question, and this is somewhat personal, but if you are, for example, waxing the carrot, or taming the one-eyed monster, or choking the chicken, are you able to maintain an erection? Okay, you are. Very interesting. Well, first, to rule out one of the most common causes of erectile dysfunction, I'm going to check your blood pressure. Now, believe it or not, high blood pressure is one of the most common causes of ED in men. So what we're going to do is just slip this onto your arm. Yeah, just like so. Just like so. Now, Okay. Your blood pressure is just fine. Got you at about 124 over 76, which is a good number. And so, if you haven't experienced high blood pressure at any other time, then I'm guessing that high blood pressure is probably not a cause for erectile dysfunction in your particular case. Now, while I'm at it, let's get a listen to the old ticker. Probably should have done this earlier, but if you won't tell, I won't. Okay, take a deep breath in for me, and exhale. Deep breath in, and exhale. Okay. Deep breath in, and exhale once more. Okay. Everything sounds normal. Now, since ruling out the most common culprits in erectile dysfunction, I am left thinking that perhaps the cause could be either emotional or psychological. So, tell me, what is your current relationship status? Okay, you do have a significant other. I see. Well, this is quite out of the ordinary, but do you happen to have a picture of your significant other? I see. Would you mind if I were to look at it? Oh, fantastic. Okay, thank you. I appreciate humor in a man. So, do you have the real picture? Oh, this is the real picture, you say? Oh. Oh, I see. I see indeed, okay. Well, I'll let you take this back and do what you will with it. I think I have determined your issue. But first, let me share a personal anecdote with you. I feel that you may have some emotional baggage after what I've seen and the fact that it makes no sense whatsoever. As a small child, my parents took me to the circus, and at the circus there was a freak show. Now, these days, you do not see freak shows because the politically correct culture that we live in today frowns upon such things, because even freaks are people, as though midgets are really people. I digress. At this freak show, I saw a lady, a woman to my 9-year-old eyes, who had the most robust black beard that I had ever seen in my young life, and I was absolutely captivated by her beauty. And for many years after that, I was very confused about what I found attractive. So, of course, in my opinion, a woman without a beard was disgusting and almost subhuman. However, I have digressed. The point that I want to make here is that things can happen that traumatize us for life, and the choices and the experiences that we have should not define who we are today, and definitely should not define who we choose as a partner. And I feel that there must be some circumstance that has led you to make the choices that you've made as far as your relationships are concerned. Now, I have a prescription for you. Now, on this paper, please you go ahead and take this. Now, on the paper that I have given you is an address to a pharmacy. Now, this pharmacy has medicines of every ethnicity. Every ethnicity. For example, there are African medications, European medications, Asian medications. Now, I highly suggest the Asian medication. It is particularly potent and effective in my medical opinion. Now, when you arrive at this pharmacy, you will see the head pharmacist. Tell her that Dr. Sachs has sent you, and she'll know exactly what to do. And I believe that you will find that your erectile dysfunction will be a thing of the past. Now, you visit the pharmacy and come back and see me in approximately 1 week and let me know how your problem's going. You have a good day. Oh, and just so we're clear, I think that you were looking at me as though you do expect a pharmacy. I am speaking metaphorically. The pharmacy is a whorehouse, and the Asian medication is Asian prostitute vagina. Okay, just wanted to clear that up with you. Didn't want to leave any misunderstandings. You have a good one.